I became an aromatherapist almost 20 years ago, and bringing it into the healing care program, which is part of the ProMedica Cancer Institute. And we use the aromatherapy as part of our overall healing care program. And we've been doing that since about 2016.
We're very fortunate that we can use aromatherapy in a couple different ways. So we do have the healing care team and the nurses that will use it in one-on-one sessions where they'll do inhalation methods to help with relaxation or anxiety. In radiation oncology, we also use it in the treatment room. So we have diffusers in the room for our patients, and there are oils that the nurses have guided our therapists on using that can help while the patients are actually getting their treatments.
Partway through my chemo treatments, like the third or the fourth chemo treatment, I was introduced to healing care. And with one of the chemo drugs, I have a horrible side effect with restless leg. And they suggested aromatherapy, and I'm like, sure, like I'm gonna try anything. In the very first session, it really lessened the side effects of the restless leg greatly, where I could relax, sit in my chair, where previously, before the aromatherapy, I was standing, I was sitting, I was moving around trying to get comfortable and alleviate some of the restlessness. But with that aromatherapy, it changed the outcome dramatically.
So some of our favorite oils, I would say, is lavender, Lavandula augustifolia, which is very calming. It can be very helpful for sleep. We may blend that with a little orange, a little citrus, to kind of just help in that relaxation and comfort. We do use a lot of frankincense, Boswellia carteri. And that is something that many of our patients find to be very uplifting and just very grounding. And then I have to say my absolute favorite, and many of our patients, is peppermint. And peppermint is energizing, yet it's very cooling and can be very comforting in many cases.
I use a combination, and I just love it. It relaxes me. It helps me sleep at night. It just helps a lot.
So when I have people come in starting with a session, I first do an assessment of what their symptoms are. And then based on that, I always start with essential oils. So we put one drop on a tissue and we just use an inhalation method, and then they get to take that tissue home with them. So I feel like the session continues even after they leave here. They have some good benefits that come from that.
I've been using the peppermint essential oil. I feel pretty good when I leave because I'm more relaxed. My pain has been relieved some, just an all over better feeling. You know, just my knees don't hurt as bad. I'm more relaxed. Maybe my headache has gone away, you know, things like that. It's just a great feeling. And the last time I was offered it, I didn't do it. And this time I'm so glad I did.
And so it's really rewarding to see these patients come in really high stressed with lots of symptoms and know that after a session we've minimized some of that and they leave feeling better. And that's one of the huge benefits of the healing care program, is even though it's sad because we're in the middle of a cancer center, it's also very good because patients leave feeling better than when they came in. And so that's really rewarding, and I think that just shows you the benefits that we can do with combining the aromatherapy and other complementary treatments.
Aromatherapy is one of our newest and most popular healing care strategies and supportive therapies that we use for our patients. It has truly blossomed, and we are both honored and privileged to be able to have Debra Reis working as part of our team. We are thrilled beyond words to have been selected as the recipient of the Gattefossé Award. This is the first award that has been received in the United States of this nature, and it really gives us the opportunity to build upon our aromatherapy research and contribute to that body of evidence.
I believe the award will benefit our whole center. Absolutely, our patients. It's going to be very beneficial as far as how aromatherapy is going to help in their condition or situation. It absolutely is going to help our family members and definitely our staff, because we all are dealing with stress and issues with stress, and aromatherapy is one of many tools that can be very beneficial for an overall plan.
I think it should be automatic. It should be hand in hand with any medical treatment. It's important to integrate the supportive therapies in and along with the traditional medicine.